Welcome to the President's Podcast with the Black Nurses Association of Greater St. Louis. You are listening live to your host, Dr. Leonora Muhammad, President of the BNA STL.
And I'm your co-host, Vice President Mia Glover.
And I am joining in on the fun today, a member and also treasurer of the Black Nurses Association. Proud to welcome Dr. Kendra Holmes from Affinia Healthcare.
Thank you. Thank you all for having me. Thank you.
Welcome, Dr. Holmes. We are super excited to have you on the show today because you are a boss in the St. Louis community. You are serving as the Senior Vice President and Chief Operating Officer for Affinia Healthcare, which is formerly Grace Hill Health Center. And this community clinic, it provides primary and preventative healthcare services to more than 43,000 patients per year. I didn't check the website. I did my research, right? So y'all are doing it. So welcome to the show, Dr. Holmes.
Thank you so much for having me. Thank you for allowing me to highlight the work that Affinia is doing and the work that we're doing in the community.
All right, absolutely. So for our young kids that are paying attention and listening to our show, tell them a little bit about your background, because whenever we meet kids in the street, they always want to say, you a doctor? How did you become a doctor? What do you do? What can I do to become a doctor? So give them a little bit of background about your history and how you got started.
Well, first and foremost, I am a product of North St. Louis. That's one of the things that I always like to showcase. So just like I was able to come out of North St. Louis, other people are able to, and other kids are able to do the same thing. So St. Louis native, born and raised in North St. Louis City. I've had a great family, great upbringing and childhood. I went to Metro High School, which is one of the top high schools in the state of Missouri.
Yes.
After high school, I went directly to, it was then St. Louis College of Pharmacy. It's now the University of Health Sciences and Pharmacy. But just always had a passion for healthcare and working in underserved communities. I knew from the very beginning that I wanted to be in my community. I didn't want to move out of the community and serve other people who aren't necessarily as in need. So from day one, that was really my passion. Right out of pharmacy school, I graduated with my PharmD, and I went to work almost immediately to then, as you mentioned, Grace Hill Health Centers. Currently Affinia Healthcare. I started off as a staff pharmacist, really had no intentions of being in administration, just wanted to have that direct contact with patients. Loved that, stayed in that role for all of probably 7 months and was promoted to the director of pharmacy. And then over time, just a progression. Community health centers have a lot of need because the patients have so much need. So there's always an opportunity to grow your skills and to say, oh, I can help with this area or I can help with that area. So I was very fortunate to be promoted numerous times to the director of pharmacy and radiology, then moved on to the director of pharmacy, radiology, and laboratory services. Then another promotion to vice president of clinical integration, finally to chief operating officer, and now senior vice president. But this is really my life's work. I've been with Affinia since I graduated from college, and it's the job that I really feel is my passion and my life's work.
Right. That is absolutely amazing. And if you anything like me, you've been volunteered and promoted, and people see things in you that you don't necessarily see in yourself. And so that's why I think one of the reasons why you were promoted up into those positions. So we need people that have grown up in that community, that know the challenges in that community. Because I'm from the north side, I'm sure Mia and Dawn, from the city. So we understand, those connections, right? St. Louis Avenue and
all right, westbound.
Right, not too far from each other. So it's great to see women in our community moving up into those positions where we can make change. So that's awesome. So we've been seeing you doing magnificent things around the St. Louis area and leading the response for the COVID-19 pandemic in August, I think, of 2020, because you were newly promoted into that VP role. So, and you've also worked with one of our previous guests, Mr. Keith Stallings from the Access Foundation. mission. I seen that video on
Awesome.
social media. You guys were out there doing COVID testing. So tell us a little bit about that experience and, you answering the call for the response for the COVID-19.
So I will say that my response was initially being upset. And it was, I was upset, quite honestly, because initially we all knew that the individuals that would be most impacted by COVID-19 were Black people and brown people and underserved communities. And when there was not an immediate response to put testing in North St. Louis City and North County, in areas of South City where Hispanic populations reside, it was very frustrating to me. And we just basically knew we had to do something because it wasn't going to be done. And honestly, I don't think if we had done it, it would be done to this day because it still hasn't been done, and no one really talks about that. It still hasn't been done by the large hospital systems. So, it was just something that we felt that we had to do. And the other piece, which I think was just a huge missed opportunity for a lot of healthcare organizations, is that we always knew the vaccine was coming. So we always had in mind that we need to be out present in these communities, connecting with individuals who, may not want to get the vaccine, but just to let them know that we're here to build that trust with them, because ultimately the end game was the vaccine. And when we look at the vaccine hesitancy that some organizations are seeing, and they wonder, well, why aren't they coming to get the vaccine? Because we don't trust you, and you didn't make yourselves trustworthy to us. So, I think that initially it was quite a bit of frustration, but then, as an organization, I think we just really rallied behind it. We had a shared mission, our providers, our wonderful nurses. I can't say enough for the nursing staff that were out there. I tell you, we were out there at the Sears building at 90 degrees and we were just falling out.
Oh, wow.
We were going down, and it was just like, okay, we've got to stop this testing. But it was 100 people in line that were all symptomatic. And they were like, no, we got to keep going. And I was like, no, we can't do it. But just the need, and just the fact that, once again, people of color were not receiving the care and, resources that they needed.
Yeah. And what, we was out there, the Black Nurses Association of Greater St. Louis, we were out there on the flip side. We was out there in about 30 degrees doing COVID testing with the Urban League,
Yes.
So we understand that, but it's so important that we get out there and we talk to our people and let them know, what some of the reasons why they should get the vaccine and why it's important to protect them, not only them, but their family too as well.
Absolutely.
Yes, and COVID is a huge issue in our community, but we know it's not the first or the only, right? So as a frontline person, as a VP of a major community health center, as an administrator, what are some of the imminent health needs that you see in our Black community?
You know what? Of course, I can talk about different health conditions: diabetes, hypertension, cancer. I think in my opinion, the immediate issue is racism in the healthcare system, that we don't receive quality healthcare. And I think that, until that issue is addressed, we will continue to see health disparities. And until people like us call it out and call it for what it is, we will continue to see that. I always talk about how African-American women, regardless of your socioeconomic background, your education, your financial status, you're still twice as likely to die during childbirth than a white woman. And it has nothing to do with access to healthcare. It has nothing to do with my education. It's because my life is not valued, and the life of my child is not valued to that of a white woman. So until we address that and call it out and put people that look like us in positions where we can advocate for our people, that to me is the healthcare threat. It's not COVID. It is racism in healthcare.
Dr. Holmes, I have the pleasure of working under your administration.
One of our wonderful providers who takes care of our patients in our community.
So as a nurse practitioner who works for Affinia Healthcare, I know some of the challenges that we face But can you tell me a little bit about the services that we offer? You know, I know what we offer, but can you just speak on the
Sure.
services that Affinia provides? And
Sure. So Dr. Muhammad mentioned that we provide primary preventive health care. So that includes family practice, adult medicine, pediatrics, women's health services. We also have a lot of ancillary services. So we have chiropractic services, we have MAT services. So we have substance abuse services, which Dawn knows quite a bit about that.
right.
So optometry, we really work to be a one-stop shop. So, you know, there's linkages to specialty care as well, but we want individuals to be able to get, you know, if you need x-rays, if you need urgent care services, we want to really be able to provide those services in your community so that you don't have to drive to West County to get quality health care. So we really are comprehensive, and I forgot our dental services. Dental services as well. I can't forget pharmacy because I'm a pharmacist. So pharmacy, radiology, laboratory services, and then also, you know, outreach services and our chronic disease teams are very important. Our maternal child department is really essential when we again see all of the disparities in infant mortality and maternal mortality. So, you know, we have a really great maternal and chronic disease team that goes out into the community, trying to get individuals connected to healthcare. And again, more importantly, just to build that trust and let individuals know that we actually care about your health and the health of your child.
Yeah, absolutely. And I had the pleasure to do some of my clinical rotations there at Affinia Health at the Biddle location, and then also the one on West Florissant, North Florissant.
Yeah.
So the patients were wonderful, and they showed up for their appointments. I can tell you that they wanted that healthcare service and they wanted their treatment, and the staff was so great with providing that and making sure they did everything extra to make sure that the patients get what they need. And I know one question that they always ask is, can they come and do they have to have insurance? How can they pay for this medical treatment? What can they do?
So quite a large percentage of our patients do not have insurance. So we do have a product called Gateway to Better Health. It's not insurance, but it is more so of a grant-based supplement where individuals can receive primary care services, specialty services, some dental services under a very small copay system. So 50%, $1, $2. But we also have a really great outreach program. So individuals who qualify for Medicaid, we have staff who actually enroll their children in Medicaid. Of course, we also do the Obamacare, which, so we try to make it as easy as possible, but we are a federally qualified health center, so we can't deny anyone based on their ability to pay. So we have to set it where, individuals, you may have a bill, but, you still will receive those services.
Oh, that's wonderful. That's wonderful. I'm glad you talked about that because we get that question a lot about, access to care and making sure that they can still be seen even if they have the inability to pay. So that's
so there's a sliding scale fee service that we offer for the patients if they're unable to afford services.
Yeah, I'm a Grace Hill kid. My mom worked there for 22 years.
Really?
So all my childhood care came from Grace Hill.
Oh, that's so
Dr.
awesome.
Yolette Brown was my pediatrician. My
I used to be my
dentistry was all
boss.
done there. Oh, see, Dr. Brown didn't play either. She had my brother asthma under control. Okay.
Yes. She
So
is
now I'm
amazing.
Yes.
She is amazing.
Truly cared, wonderful. And when I got out, when I became an adult and I got out and was able to compare, I wasn't shafted on care. I got amazing care growing up, and it was more than enough. I'm here, I'm healthy, and thank you, Grace Hill.
Awesome. I'm so glad to hear that. And Dr. Brown is a provider of color, I will add.
Yes.
Oh yeah. And everybody is her family, and she knows how to meet you where you are and deal. She was really, really amazing. And so I think that was really the standard that you all set early on. I have so many fond memories, and really I'd like to say that Grace Hill probably played a great role into me becoming a healthcare provider, because you got to see my aunt. Actually, my mom was a social worker who was through the More Time Dollar program under Dr. Ebele, and neighbors taking care of neighbors. That was a whole big thing. My aunt was in charge of the asthma camp, and We did some of that at that little house that sits off of Hadley. I don't remember what the name of it was, but
House.
Yes.
what was it called? I don't know. But
The Hadley House. Well, that's what it's called now.
yeah, but it was like, I have so many fond childhood memories of that. But what resources do you think that we still need to improve the health of Blacks right now?
So at this point, I think education is really important just for the COVID pandemic. And I say that because there's still a lot of misinformation in the community about the COVID vaccine. We still have, a segment of the population who just absolutely do not want to get the vaccine. And, what I try to do is just, again, is about meeting people where they are. So you don't just say, oh, that's wrong and that's not true. You just have a dialogue with them and try to get them to an understanding. And that's basically all we could do. But I think we need to continue to stress the importance of the COVID vaccine. We know that people of color have been disproportionately impacted as far as hospitalizations and mortality. So we do definitely need to continue to stress the education piece. Resources, kind of all the resources that we try to provide. So people still have food insecurity. We still have our food pantries where we have lines of cars 3 blocks long for individuals who are in need of food. We still have individuals, moms who are in need of diapers, feminine hygiene products. It just saddened me, working at the school-based health centers to see so many young girls who don't have access to feminine hygiene products. And, some people may not even think about that, but that is the reality for a lot of young girls and women. Resources, of course, jobs, education, I could probably talk for 2 hours about the education system in St. Louis, but I don't want to go there. But, just basic resources, access to care, and not just care, quality health care, and not just to provide any type of low grade quality, care to individuals, but to provide the care that they deserve.
Absolutely.
Dr. Holmes, how can the Black Nurses Association support Affinia, support community efforts? What can we do? Because we do these things on a small level. So one of the reasons I really wanted to connect our organization with you is because I know that, our group of nurses would work very well with the nurses that I work side by side with at Affinia. As you shared, they were wonderful during the initiation of COVID and getting started with vaccines. They worked their shifts plus regular, overtime shifts on Saturdays and Sundays to provide not just testing, but vaccines, a vaccination when they became available. We have nurses who have put together hygiene kits that you're talking about just on our own. We do everything kind of individually and come together collectively. But how can we support Affinia as the Black Nurses Association?
So I think number one, you support us by just being visible. Just seeing Black nurses, and having just young individuals, people of color, see that there are nurses who are professional and out there taking care of the community. I think that, right there is definitely support. I would love for you all to get our nurses more involved in your organization, because I think for some, they're just not aware of the resources in the organization. And also we have a lot of partnerships with school-based health centers. So we're at Normandy High School, we're at Live for Life, we're at Confluence. And again, it's really important for me to grow that pipeline of Black nurses and Black healthcare professionals. So even the possibility of just being present in the school-based health centers, doing some fairs, letting them see additional Black nurses, I think that's really important for representation for our community as well. I serve on the board of Goldfarb School of Nursing. And one of the main reasons that I did that is because I want to try to increase the pipeline of Black nurses. So if there is information and resources, different programming that you think would be helpful for Black nurses and education, to feed me that information so I can then really advocate for that with Goldfarb and with BJC and WashU as well, that would definitely be helpful.
Oh, that is wonderful. And that is definitely something we want to do, because if they see us and see what they can be, they're going to try to strive to do it. So that is absolutely something that we love to connect with, the school-based programs, and whatever you need us to do, you just tap into us and let us know we're here. We're a mighty team of how many, Mia? How many members? She's our membership chair too as well. We almost at 40, right? 40.
Oh, we're at 50.
Oh,
awesome.
51, actually. We just got a new
Absolutely.
lifetime membership today, but y'all don't know that yet.
Oh, thank you. Thank you. Yeah. So we absolutely want to
awesome.
increase our membership, and we want our youngins to know that nursing is out here, that we want the community to know that the Black Nurses Association of Greater St. Louis out here. We out here to help in the community, whatever you need. So Mia, tell them, our listeners, how can they get in contact with us as the BNA of Greater St. Louis?
So our website, our local website is www.bna-stlewis.org. Our Facebook, Instagram at BNA Greater St. Louis. Our chapter meetings are every fourth Saturday of the month via Zoom. But right now, actually this upcoming next meeting, July 24th, is going to be at Chamberlain College of Nursing as our newest sponsor, offering us space to grow.
Yes, absolutely. We're excited. So, Dr. Holmes, tell our listeners how to get in contact if they need to come to the clinic. Where can they contact you to set up an appointment?
Sure. So you can visit our website at affiniahealthcare.org, or if you need an appointment, you can call 314-814-8700. You can also schedule, if you need a vaccination for COVID-19, you can schedule that online at the affiniahealthcare.org. Also follow us on Twitter, Instagram, and Facebook.
Yeah, and you're gonna see Dr. Holmes all over the screens and in the community. I already told her, I feel like I know you already because I see you everywhere. St. Louis American newspaper, you everywhere. So thank you so much for being a part and coming to talk to us on the President's Podcast with the Black Nurses Association of Greater St. Louis. We appreciate you. We are proud of you. Continue doing the good work that you do in our community because it's needed, and we need people like you that grew up on the north side of St. Louis, yes, and that know those challenges. So we appreciate you so well.
Thank you so much. And thank you for all that you all do to advocate for Black nurses.
Yes, thank you. Well, tune in next time to the President's Podcast with the Black Nurses Association of Greater St. Louis. Tune in. We are on our social media pages, Facebook, Instagram, our YouTube pages on the second Wednesday of the month. So you can catch this episode next Wednesday. And right now, thanks everybody for my co-hosts, Mia and Dawn. So we're going to continue on. So thank you for joining in because we are the pulse to all things nursing in the loop. Nursing in the loop. Peace. Thank you.